Welcome to Joint Ventures, an OSC original podcast. I'm your host, Dr. Jeffrey Carlson from Orthopedic and Spine Center in Newport News, Virginia. Today, we're diving into a topic that affects nearly every patient, the cost of healthcare, and why independent care still matters. Hospitals acquiring private practice is a trend that's been growing for years, but what does it really mean for patients' costs and the quality of care? Let's break it down. Healthcare costs are on everybody's mind these days. A new study from Emory University confirms something many of us in independent medicine have observed firsthand. When hospitals acquire private practices, costs tend to rise, sometimes significantly, without necessarily improving the quality of care. That's important to understand. It's not just a line on a bill. It's a difference in how care is delivered, how decisions are made, and how patients experience the system. Independent practices, like many outpatient centers and private practice offices, are often designed with affordability in mind from the very start. Why does this matter? Smaller independent practices typically have more flexibility to focus on the patient rather than the institution. Decisions about care aren't driven by bed occupancy, imaging quotas, or system-wide revenue targets. They're driven by what each patient truly needs. When hospitals acquire practices, they can have some real benefits, like access to additional resources, coordination across specialties, or broader networks. But the Emory study shows a cautionary tale about consolidation, which comes with higher costs, more administrative layers, and sometimes no measurable gain in outcomes. Independent care preserves choice, transparency, and accountability. It keeps physicians and teams directly connected to their patients, making it easier to provide personalized, efficient, and cost-conscious treatment. That doesn't just save money, it preserves trust. At OSC, we see this philosophy in action every day. Our model prioritizes value, delivering high-quality care in a way that's efficient, patient-focused, and affordable by design. Independent medicine isn't just a business model, it's a commitment to putting patients first, keeping care accessible, and maintaining the human connection that makes medicine meaningful. So if you're navigating the healthcare landscape, remember, independence can be more than a word on a practice's sign. It can be a pathway to better, smarter spending and an experience designed around you. Thanks for joining us on today's episode of Joint Ventures, an OSC original podcast. Independent care matters now more than ever, and staying informed helps you make the best choices for your healthcare. Stay curious, stay empowered, and as always, take care of yourself, because the right care starts with understanding the system and knowing what your options are.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.